Welcome to today's COVID-19 update. We're speaking with the Honorable Minister of Health, Dr. Frank Anthony. Minister Anthony, again, thank you so much for joining us.
Well, thank you for having me again on the program.
Yes, sir. As it's in the news, let's begin with Maraca Bay. We read that there is an imposed curfew now. Could you tell us a little bit about that?
Well, we had a team that went in yesterday to Maraca Bay, and the team had regional officials plus the health officials and of course the police. So it's a combined team, and they had discussions with the residents. And I think from the report that I've received, it seems that the residents are now more receptive. More people are cooperating. They have agreed that they will abide by a 6 to 6 curfew. And the team also spoke to bar owners in the community and get them to comply with the COVID-19 regulations. So hopefully we'll start seeing an improvement in terms of compliance with the regulation, and the medical team would continue to do testing, monitor those who were currently isolated to see whether or not they develop additional symptoms. So it's ongoing work, and we will get some more test results, at least the testing that was done yesterday. We have sent those to the lab, so maybe by today, tomorrow, we'll start getting those results.
Okay, usually when people hear the word lockdown, alarms start to go off, but from a medical standpoint, could you explain to us why this was necessary?
Well, they're not in lockdown. They're just having a curfew, meaning that they go home and stay home from 6 in the evening to 6 the next morning. So that's in no shape or form called a lockdown. People are still allowed movement within the time that is allotted. So I think they can get about doing their economic activity as well as complying with the guidance that was given to them.
Okay, thank you. We realized that from yesterday evening that the COVID-19 emergency measures, they were basically amended to allow for indoor dining. Could you speak to us on that?
The measures, we have changed them slightly. There's a slight tweak, and that is we want to provide for some form of indoor dining. And before establishment can be granted permission to do indoor dining, they have to go through certain checks. The task force has been working with the Guyana Tourism Authority, and that authority is going to assist the task force in going to every indoor restaurant, and there are specific guidelines for compliance, and they would do an evaluation of the premises. Once they evaluate the premises and see that they meet the requirements, which include determining capacity, then you look at the spacing, how the tables are going to be laid out, the distance from each other, and so forth. And once that checklist is complied with, then that facility would be licensed to do indoor dining. Now, indoor dining is not going to be, if the facility has capacity to seat 100 persons, then we are only allowing 40% occupancy. So it's not, you're not going to have full capacity. You're going to have a reduction in your capacity, and that ought to be complied with. So each of the places that would be authorized, a sign would be posted about how many persons they can accommodate. And if they're in breach of that, then we would withdraw the permission, and they would not be allowed to operate indoor dining. So it's a very strict process that they have to go through. The GTA has started working and going out and meeting these restaurant owners and start doing the assessment to see whether they'll meet the requirement. and then they would be licensed, so to speak, to do indoor dining. So it's a very elaborate process, and hopefully we can have a balance in terms of keeping the public safe, and at the same time the persons who are desirous of having these facilities open can utilize the service. But all of this would have to be done in strict compliance of the regulations. I want to also emphasize that opening restaurants do not mean that bars can be open. In the regulations, bars are still prohibited. Okay. Because very often people abuse the process. We are not allowing bars to be open, and so I just want that to be very clear.
Okay. I noted the collaboration with the GTA. I know that the task force itself, in collaboration with the police, would conduct the monitoring after. How much involvement would the GTA be playing in that?
Well, we have had a partnership with them before, and that is when we were doing assessments for small hotels and resorts and so forth. And they went out, did the assessments, and when the institutions met all the compliance requirements, then they were allowed to operate. So they received a sticker to say that they're in compliance, and then even after they have been deemed to be in compliance, there is a monitoring mechanism to ensure that they're keeping to those guidelines. So we have seen that they've done good work with the resorts, and that is why we're now partnering with them to look at the restaurants.
Okay. I wanted to take you from that to another scenario. So in the event of several persons in a work environment being exposed to an infected person, what is the protocol there?
Well, first of all, what is the work scenario that we're describing? Because as far as I'm aware, in every work scenario, in every indoor environment, people are still, still should be abiding by their, the requirements, which include wearing your mask at work, not putting it under your nose or under your chin. So if you've been wearing your mask, keeping social distancing, and sanitizing your hands, then you would have minimized that infection or that exposure. If, however, that has not been done, then there is that possibility of getting infected. There's also another factor, and that is we have to look at what is the possible duration, how long that person would have been in contact with the other person, and what activities they have been engaged in, and whether those activities were in close proximity. So if they've been speaking to each other and they've been in close proximity without masks, then there's that chance of infection. So there are a number of things at play that can influence whether a person who has come in contact with an exposed person, whether they will need to go into quarantine, get tested, and so forth. So the hypothetical scenario that you're posing, we'll need to get more specific details before we can really answer that. But that's something that we should all bear in mind.
Okay. In this particular scenario, though, how does the employer treat with this situation? Well,
I can't answer you with any specificity, because the practice has been people come and say they have been exposed to somebody and they all go home. And that has been abused. So it's not being used for public health purposes. It's people abusing the system to just go and stay home. We have to have a verified source that this person actually had the infection. And if they did have the infection, and they were in the presence of other people, and those persons were not complying with the guidelines by wearing masks and so forth, then we probably have a genuine case of possible exposure. If that is the case, then those persons who have been exposed would have to go into quarantine, or we can, after a few days, we can test them. So the quarantine period doesn't have to be a prolonged and extended period. Because if we test them and they're negative, then they can come back to work. If we test them and they're positive, then they stay in isolation for at least 10 days.
Thank you. That clarified a lot. And I must note as well that the ministry has, spraying is still being done for these work environments that would require them. They can make that request as well. Yes,
we do that, but we would prefer that various institutions take on their own responsibility.
Okay, all right. I'm taking you over to another matter that made the news. The UK has just banned flights from Brazil and other South American nations. So we wanted to ask you your take on that and if this impacts us in any particular way.
Well, the virus, as we all know, has been mutating. In some cases, the scientists have postulated that you will get a mutation every 2 weeks. There are various scenarios, but the virus has been mutating, and we have seen one such mutation in recent times happening in the UK. We have seen another one happening in South Africa, and the most recent mutation that is of some concern, what they call a variant of concern, was detected in Brazil. However, at the time when it was detected, maybe about 2 or 3 days ago, it became more known, and what are the types of mutations and so forth on the virus. By that time, PAHO has estimated that the variant might be in a number of South American countries. The reason why they have said that, because they have a network of 21 laboratories that have been doing genetic sequencing, and they've detected this variant in some of those countries. So that variant is in Brazil for sure, and one of the characteristics of that variant is that it's more transmittable, meaning that you can get it much more easily, and that is why we'll have to take precautions. There is no specific method of preventing it other than those measures that we have been taking right now, meaning that you have to wear your mask, you have to keep your distance, and so forth. And if this is more transmissible, then more people are going to get infected, and if more people are going to get infected, then we can assume that we'll get a percentage of them, a higher percentage of them coming into the hospital, coming in from the hospital needing ICU care. So these are going to be the challenges if this variant circulates in our country. So it is something that is now being investigated. It's only been detected about 3 days ago, and a lot more work would have to be done for us to determine the characteristic of this particular variant, not only its transmissibility, but if there are other characteristics, and how fast and what would be the clinical picture of this type of variant.
Okay, I noted that you said that we must continue to do what we've been told to do, which is the wearing of the mask and washing hands.
These are the only preventative measures that we have currently.
Yes, sir. All right, on that same question, Starbrook News specifically wanted to know how concerned, and you partly answered that, but they're asking how concerned is the government with this new strain, and specifically that it's right in Brazil that is neighboring us. And secondly, they wanted to know if government would likely close the border to Brazil if it became necessary to do so.
Well, we are very concerned, and in the international community, as these mutations occur, and we can see specific variants being developed, they're actually named variants of concern. because of the types of mutation that you see. So we are very concerned. And because of its proximity to us, we also must pay attention to that. Our land border has been closed for some time now. We haven't really opened our land border. So the bridge over the Takatu has been closed. We do allow on Thursdays very limited amount of interaction where goods come over from Brazil and goods from Guyana go across to Brazil. So there's a very limited interaction, and that is properly supervised by the health authority of both countries. On the Brazilian side, because we've had a problem with a lot of people crossing over the Takatu illegally, and while it's a very long border and very difficult to patrol, on our side we had the joint services working very hard to be able to cover that area. But on the Brazilian side, they have also increased patrols. So for some time now, movement between the two countries have been severely restricted along the land border. We nevertheless have to continue to be vigilant about it because we don't want cases to spike, and then if it's a variant that is very transmissible, then we can easily see an increase in cases. The health authority in Region 9 has been alerted, and they have been on the lookout for any changes in the epidemiological pattern. We have our kits that are up there, samples come out there regularly, and so we are going to pay closer attention to what is going on in the bordering areas.
Thank you, sir. We have some questions from the Guyana Chronicle, and they're asking, could you explain what is day 3 gene testing for COVID-19?
Well, as you by now should know, that the types of tests that we have in Guyana, there are a couple types of tests. Well, there are 3 different types of tests. We have PCR testing, we have antigen testing, and we have antibody testing. So the first 2, the PCR and antigen tests, would go after specific fragments of the virus, and that's how you would be able to detect it. In the case of this, if you think about PCR testing, we can then break it up into maybe different subtypes. So you have some PCR testing tests that would be able to detect, say, 3 fragments of the virus. Others might detect 2. And so that's basically the difference. So this is a very technical thing, and these are the kinds of distinction that at the labs they would be able to make those types of differentiation.
Okay. They're also asking if you could say whether the types of testing is used in Guyana to test for COVID-19.
Well, we are doing PCR testing, yes. So I don't know what else. Yes. That's the only, PCR is the only methodology, well, initially was the only methodology used to detect viruses. And what we have been able to do as soon as well, not we, but as soon as this, the genetic structure of this virus was published, I think around the 10th or the 11th of January, there were people who, I think there was a man in Germany, Christian Dorsen, I think was his name, who was able then to develop a specific PCR tests for the COVID-19 or SARS-CoV-2 virus, and that is the one that is predominantly used across the world. So basically, the virus is a RNA virus, and you have primers. So when you use that, it converts that into a DNA, and then we amplify that DNA so that it becomes more detectable, And then once we can able to detect that, then we know the person is positive. So there are different steps along the way, right? And that is what we've been using. And so while most of the world is using the one that was developed in Germany, the US have developed their own tests. CDC has developed its own particular test looking at a different part of the virus. But nevertheless, all these types of tests are able to detect the virus.
Okay, thank you. Finally, they're also asking, has Eureka sent the abnormal COVID-19 sample that was reported? And if yes, what have those been sent to Curfew?
Well, as of today, I understand they did send over a few samples to the National Public Health Reference Lab, I think yesterday. And so that now is going to be looked at and then eventually processed and packaged and sent to Curfew.
All right, and just for clarity, this word is genomic sequencing. That is what it's being sent for, right?
Yeah.
All right, thank you for that. Minister Anthony, again, thank you so much for speaking with us.
Sure, no problem.
Well, that's it for today's COVID-19 update. We, of course, just spoke with the Honorable Minister of Health, Dr. Frank Anthony. Remember, for more information, you can log on to our website, dpi.gov.gy, and the Ministry of Health's website as well, health.gov.gy, and, of course, our social media platforms.